Well, good morning, everyone. My clock has us at 10 a.m. Eastern Time, so I'm going to go ahead and get started. I'd like to welcome everyone to our CNG session today. As a member of the Board of Directors for CNG, I'll say that we are happy to see everybody, to see the good registration numbers. I know for me personally, it's nice to see these familiar faces and names, so thank you all for joining us. Let me get my screen working here. If you don't know me, my name is Cynthia Allen. I work with Seacrest, and I'm also, as I mentioned, a member of the CNG board. I want to go through just a couple of housekeeping items before we get started on our session today. Your lines have been muted upon entry. If you have unmuted for some reason, please go ahead and just remute that, hit that button again. We'd like to make sure we're keeping our background noise down or any feedback that we're hearing. So keeping it muted during the session will be helpful. Our panel members will be using video. You are welcome to use video. You are welcome not to use video. If it's just a Friday morning and it's not that time to be sharing your camera, that's totally fine. But feel free to use it if you'd like. We do have a number of pre-planned questions that we're going to be going through today. Our hope is that the discussion leads to many more questions that you all have. We'd really like to keep this open and really make sure we're taking advantage of the knowledge and experience our panelists have to share. So please feel free to submit those questions, comments through the chat feature. I will be doing my very best to monitor the chat feature along with my colleague from the DC Program Planning Committee, Colin Biddle, who will also be looking at that chat feature and trying to capture as many questions as we can. We will pause periodically in between our pre-planned questions to try to touch on those, or we'll get to them at the end of the session. Today's session is being recorded. We will post this recording. As you can imagine, it turns out to be a very large file. So we will post that. It'll give us a few days to get that all ready and post it online so you can re-listen to the wonderful words of wisdom from your colleagues or share with other members of your staff or volunteer leadership. So before we get started, I'd like to turn the microphone, so to speak, over to Maria Ryan, who is also on the CNG board, is chairing up the board this year, and she has just a few comments for us.
Hi, welcome everyone to our second virtual event, and I should probably call it our second recent virtual event. I misspoke last time when I declared it to be the first ever CNG virtual. There was a time in our history when the Chicago events were webcast so that DC attendees could view them and vice versa. But the board ultimately concluded that because a portion of attendees were missing out on the in-person interactions under that format, that we weren't really meeting our core mission of providing networking opportunities. And we're continuing to try to get a better handle on our online tools. And we're going to continue working on, because we would really like to be able to provide some of those networking opportunities in a virtual environment until such time as it's safe for us to meet in person again, and then we can, do what we really we're founded to do. Before I turn things over to our sponsors, I want to encourage anyone who's interested in serving on our program committees or our board to submit a nomination form by September 1st. Our current circumstances present all kinds of opportunities for creativity and new approaches. So if you'd like to be among the new voices at the table, just go to our website, certificationnetworkgroup.org, scroll down to the Get Involved section, and there are links there to the nomination forms, and the form itself has instructions about what you do with it after you fill it out. And don't be shy to self-nominate. That's the typical thing, is for people to self-nominate. So encourage you, if you're interested, to do that. So with many thanks to all of our sponsors, I'm going to turn things over to Prometric and BTL Surpass, who are sponsoring today's event.
So let me just jump in real fast before we jump to that, Maria. We would like to want to first just thank all of our full sponsors. As you all know, we provide these events typically in a face-to-face environment for free. and that is only made possible by the support of our sponsors. So on our screen, you'll see our full sponsors, BTL Surpass, Prometric, Pearson VUE, PSI, and Cobalt. Thank you to those organizations and those companies for supporting CNG this year. We also have a second level for nonprofit organizations that also help to support the CNG in our activities. Those are listed here: Medical Assistance, DANBY, BCSP, ASIS International, HUMRO, and CMAA. I have to say I'm completely surprised that I did not bungle one of those acronyms. So thank you all again for your support for the CNG events, and hopefully we'll be seeing each other face-to-face soon. Our featured sponsor for today is Prometric. So Bob, I think your line is unmuted. Can I get you to say a quick hello to our participants?
Good morning, everyone, and thanks for joining. It's a pleasure to have everyone here, and it's a pleasure for Prometric to be able to sponsor. You know, listening to Cynthia talk about the optional nature of video in this session reminds me of the world we live in today and some of the lexicon that has developed as a result. Particularly, I think about the Corona mullet, where in today's world we wear professional attire up top, where the video conference has visibility, but PJs or shorts or slippers down below where the camera can't see. You know, business up top and comfy down below. Anyway, at Prometric, we're thinking a lot about the future of assessments, the assessment anywhere philosophy, and remote proctoring is a big part of that for obvious reasons. Interest in remote proctoring has skyrocketed over the last few months. Our test center network is up and rolling given safety precautions. So happy to talk to anyone on this call or anyone really about any of these topics. But again, thank you all. Have a good session.
Thank you, Bob. I really appreciate the mental image of all of our many attendees in the Corona mullet. So thank you for that, starting us off right this morning. All right, well, let's get started and talk about our topic for today. So I'm sure you're all having these kind of conversations within your teams and within your organizations and perhaps within other networks or conferences. But we really wanted to spend some time talking about the lessons that we have learned so far in handling this crisis and the disruptions that it has caused. And we're really, for today's purposes, we're primarily focused on looking at it from an internal perspective. So as certification professionals running programs, multiple products in our portfolio, how has this disruption really affected us and what do we foresee for the future? Based on what we've learned so far, how does that shape how we might handle things in the future? And these are some big questions, and the goal for today is really just to have a discussion around them. When we were prepping for this session, I think one thing, and I'll speak for the panelists, you all can correct me in a moment if you disagree. I think one thing that became really clear was that regardless of the volume of candidates we're testing, the role that we have, whether you're a service provider, a certification organization, or any other role within the industry, there were certainly some themes that emerged that whether you had a big staff or a small staff, high volume, low volume, these themes really could apply to all, and it was just in how we adjusted them and how we were managing them internally for the size and scope of our organization. Obviously, we're not out of this. We are still facing uncertainty with what we will be facing in the next few weeks and few months and beyond that. So we really want to focus today on what we've learned, what we did well, what we hope to do better in the future, and give you some nuggets that you can take away from today's session and adapt to your own organization, discuss with your teams, discuss with your leadership. So let me take a moment to let our panelists introduce themselves. If you all, we'll start with Bill Schimmel in just a second, and then we'll go down the list. If you could just give us your role, your organization, and maybe just a snapshot of the industry you're in and some of the features of your organization or the program. So Bill, can you go ahead and unmute and we'll get started with you.
Sure. Good morning, everyone. Bill Schimmel. I'm with the Pharmacy Technician Certification Board for about the past decade. And then I started more in an operational role, and now for the past 2.5 years or so, I've been the CEO. PTCB has about 290,000 actively certified technicians. And for any that aren't familiar, pharmacy technicians are obviously working in your local community pharmacies, your Walgreens, your CVS, your independently owned, as well as health systems and hospitals. So there are probably about 400,000 somewhere in that neighborhood around the United States. And at the end of the day, they're pretty critical, along with pharmacists, in getting medications to people on an everyday basis. So when this hit, they kept working like a lot of other folks. We test about 50,000 a year in a normal year. Probably will not be that this year. And then we also recertify every 2 years. So we process about 100,000 plus, recertification applications every year as well. Our staff is about 30, a little bit under that. We run pretty lean. And I think that's about it for us. I'm going to let Levi talk in a bit about our actual assessments and products.
Great. Levi, let's go ahead and kick it over to you if you can go ahead and take the mic.
Yeah, I'm Levi Boren, and in my role, I oversee exam development, new product development. Bill mentioned that we're on the large side, but that really pertains to just one of our certification programs. We have lots of newer programs that we're launching, but are very small. So we have this very sort of huge imbalance in our portfolio. I'm in Colorado, so I've been a remote worker for years and years here, and much the same for our test development team as well as our volunteers. So we'll talk more about that as we get into it. But that's me.
Great, thank you. I always want to thank our Mountain Time and our West Coast participants. I know it's a bit early for you all, so thank you. Let's ask our other Bill on the panel, Bill Ellis from BPS. Can I give you the mic?
Sure, thanks, Cynthia. So Bill Ellis with the Board of Pharmacy Specialties. Even though we're in the pharmacy space, a little bit different than PTCB, we certify pharmacy specialists in 13 different specialties. So we have 13 programs, things like pediatrics, oncology, critical care, infectious diseases. We have a staff of 19 and about 47,000 certificate holders. So we're, a little bit of a medium-sized program, at least compared to PTCB. And I've been in this role as executive director for the last 10 years.
Great. And let me pass it over to Tammy Walker from Intelios.
Good morning, everybody. I am Tammy Walker. I'm the Chief People Officer for Intelios. Intelios and its family of certification certifies over 150,000 healthcare professionals in the sonography, physicians, and medical imaging profession. We worldwide, we have over 39 different exams that we give, and a staff of about 80, a little over 80 staff members.
Great, thank you. So I can definitely say, my team here at Seacrest is a smaller team. We have 5 people who work virtually. We worked virtually already, so that switch was a very smooth one for us. I joke that I'm used to working at home. I'm not used to my children and husband being at home, however, which lends some adjustments, we'll say. But again, our smaller team compared to 80 or 19 or 30, I know we'll still have some takeaways that we can think about how they can apply to our own organization that's a bit smaller in size. Well, great. Thank you all for the introductions. We're going to go ahead and get started with our pre-planned questions. Again, if you have comments or would like to pose your own questions regarding what you're hearing, please use the chat feature. But let me go ahead and start by asking everyone to take, a little bit of a time trip backwards to mid to late March. when we were kind of in the initial throes of COVID. We were certainly looking at closure of offices. I was in Phoenix hoping that I was not taking a road trip back to DC area. We then saw the closing of testing centers, which certainly had urgency behind how we were going to adjust to that. So Bill Ellis from BPS, I'd like to start with you in terms of give us a bit of a summary of what was your immediate response? What did that look like? And did you have a plan in place? Was there some type of response plan, crisis response plan that existed that you started with, and then how did that work?
So, yeah, I mean, March 12th, I remember the date. I actually got back into the office a few weeks ago, and I have an old-fashioned paper wall calendar, and it was kind of frozen in March, and that's where I'm going to kind of leave it as a memory of the beginning of this. So, you know, for us, the kind of level set, the shift to remote work or telework was not dramatic because we were already doing that a day a week. So a lot of the immediate response was, okay, first things first, what do our people need to do things in their situation? So, you know, we had arrangements made in advance before we went to all telework to get laptops for the few people that maybe didn't have laptops. Most people, even if they didn't have a laptop, were working from home. Now, you know, as things have played out, the idea of working from home 1 day a week to 5 days a week from something that we thought might have been 4 or 5 weeks to 4 or 5 months or now maybe 12, 14, 15 months is a little bit different. And I think that's something organizations have to consider. So my initial response, and knowing that this was serious and probably wasn't going away, was to think about what roles and what data do we need. First of all, I think we all know, right? The data is all over the place. It depends on what news station you have and what's like. So the first thing I thought of is we need a good source of data. So I wanted roles for our management team. So I made sure everybody had a unique role. So we had one person who I tasked with being our data source. We use Johns Hopkins data. I think it's widely respected, but that person on our staff right from the beginning was tasked with putting a report. We still get the reports every single day that shows the trends, the infection rates, the hot spots, all this stuff. So we had at least an agreed upon source of data to try to track this. And that would inform scenario planning, which I think is really an important part of this. I also asked someone to run front as our point person with our test vendor, somebody to handle customer service, somebody to handle professional issues that would come up. So everybody had a unique role. We also have a quality manager. So we were looking at all kinds of different issues. Everybody had a role. So that was kind of our initial reaction. I think the scenario plans, anytime you're in any type of crisis, is really important. So what's an optimistic, semi-optimistic, pessimistic outlook, and what do you base those things on? So we tried to set up some scenarios. We kind of had subscribed early on that this was going to be longer than a few weeks, and that helped inform some of the short-term decisions. We got a little bit lucky because we test in windows, and we have a spring and a fall window, and we weren't due to start testing until May, or April actually. So we had a little bit of time, you know, about a month to try to figure that out. Some people didn't. So we've been kind of fortunate, but having a scenario plan. The other thing, and we can talk about this later, which is really kind of, and I've shared this before, folks, this is almost surreal. We actually have invested in a business interruption group that we contract with to keep stuff off site, and they put us through scenario plans. And here's the really surreal thing. In December, we had what they call a desktop exercise, and the desktop exercise was a global pandemic, which was really weird. Now, I wish I could tell you it totally prepared us for this. It did not. A lot of what that exercise focused on, which is kind of morbid, was succession planning. Okay, key people didn't make it out of the pandemic. Now, fortunately, none of that has happened. But what it did force us to do is think about what if something really wild happened, unexpected, how might we be prepared? So having everything, records documented, all that kind of stuff, who has access is really valuable, I think, regardless of what the crisis is. So we were somewhat prepared in that way. So that was kind of our initial role. The other thing I want to quickly mention too, last point, that I don't know that we always think about in our industry, but we heard a lot about in the news, but it's really important. For us, what's our supply chain? So, you know, you think about supply chain and you typically think about goods, right? We all heard the toilet paper stories and food stories and all that. And yeah, that's certainly supply chain. but a lot of us rely on service providers. And so what's that supply chain look like? So one of the takeaways from this whole thing is for us to always be aware that we do have a supply chain. It's not always the tangible goods you can put in your hands. For us, a lot of it is service providers. And it's forced us over the course of these last 5 months to think about those things. And what if one of those supply chains were interrupted? So anyway, that's kind of a long answer to a short question.
No, it's great. Thank you. And we're definitely going to talk about that idea of supply chain and service providers. I have to say, you mentioned, Bill, that you felt lucky because you had more time to plan about a month before you were basically switching to a potential new modality of testing. In normal times, a month does not seem like that long. So, it's kind of telling that in this crisis, a month felt like a really long time, response time. I did also really, a point I would take away is the idea of coming together as a team with one trusted source of data. There is so much variance in the information at different points of this that have certainly led to some confusion and difficulty managing. So that's a great tip, to make sure that there is a trusted source of data that everybody is working from in their planning. Tammy, same question to you. Go back to that initial response and how your team, I think you with the 80 have the largest staff on the panel. So what was that like with your initial response?
So probably similar to Bill, I think there were a lot of similarities to Bill's story. When we really started to notice that it was going to be something big was we actually were at our annual meeting. I remember a few weeks prior, so early March, and numbers were going up, and everyone's kind of like, okay, this is serious. Like, this is really going to have an impact. And so each of our various divisions began reaching out to stakeholders. And so on my side, it's really about the people. So what do we do for staff? How do we ensure that they're being healthy? We're in a public building. How do we make sure that we can move people accordingly? Working with our IT team to get systems in place. And we had already started moving a lot of our systems to kind of cloud-based systems and things of that nature. And so being able to kind of speed that up was what we needed to do in this moment. But then also our certification team, who works a lot with our constituents and our stakeholders, and from a customer service standpoint, our marketing development team. So each of the teams, similar to Bill, I think, had their role and their groups and their stakeholders, and started really thinking about scenario planning from that standpoint, whether it was going to be 2 weeks, which is, initially when we thought this, we were like, okay, we won't be in the office for like the next couple of weeks, to now, we're 4-5 months later and we're still not in the office. But for us, it was about how do we protect the staff, and then how do we move our staff, even though we had teleworking. We had about 20% of our staff at that time who was working remotely, but we still had, almost 70 people that we had to figure out every day now moving to a remote environment. Some of them had the setup, some of them did not. And so speeding that up and moving that along was something that we had to do in real time in order for us to become fully virtual. And then since then, obviously, we've done different things, and I know we'll talk about this later, but we've done different things as this has gone on longer.
Okay. And how about PTCB? Bill, we'll start with you, and then Levi, will kick the microphone over to you. What was your kind of priority when this first hit, and what were some of the initial responses that occurred?
Sure. I think I should have told you this before, Cynthia, but Levi and I caucused a little bit, so we could each take different questions and save everybody else time, so we don't kind of walk over each other and say the same thing. So you don't have to worry about him for this one, but he will talk a lot later, I'm sure. A lot of like what Tammy and Bill said was true for us. We had everybody, or almost everybody on staff, was at least 1 day a week from home, and several people full-time remote. And that, again, that's just somewhat fortunate for us in that the infrastructure was already there in place, so that everybody had a laptop. Most of the software is in the cloud. And one of my favorite things to talk about is we have a really robust project management system. And given the size of our program, the amount of communicating that we had to do to all those certificants and applicants and just all those stakeholders, it was constant. And it's hard to think about how we would have done it without some of those things already being in place. In terms of a plan, we have a disaster plan like a lot of folks. And I'll be honest, I never opened it because I knew what was inside there was not really going to be helpful in this case. This was everybody everywhere all at once. And that the plan was not really designed for this. So that's a lesson learned right there, is that, I think we need to think a little bit more creatively about what could happen, in those cases. And a lot of what we tried to communicate, I think, to our staff, because it was, there's obviously apprehension and what's going to happen next and, how bad is this? But we did a lot of reminding that, those certificants and customers and stakeholders were all still going to work. They were all going to places of business every single day, and we were able to kind of do our best to serve them, from the comfort of our homes. So I think that just helped everybody say we have something that's really important to do here. And we were, like I said, a pretty flexible workplace already. And, we take that flexibility and just put it on steroids because now we're all, with children, pets, and everything else all at home at the same time. And I think that helped us kind of focus and get our work done.
Great. So let's talk about what's coming next. And I asked that question with some pause because I don't know if we all know exactly what, as I mentioned earlier, the next few weeks, few months really look like. But based on how you responded in those kind of initial, more chaotic times where there was a lot more urgency, that crisis hit and there was a much higher sense of urgency to deal with it. What did you learn from that now is informing how you're going to handle the next few weeks, next few months, beyond a few months? I think both bills mentioned having disaster plans that, weren't necessarily applicable to this, and that certainly sounds like an area where perhaps you're focusing in the future. But let's start with BPS and Bill Ellis. What is it that you're focusing on? You talked about short and long term, the idea of your staff working all virtually for a few weeks, now a few months. What if it's longer than that? What is the long-term plan, and how are you kind of prioritizing there?
So, everybody would like to kind of know when it's going to end. I would like to know too. We're really assuming we're going to be out of the office through the end of the year and very possibly for the next 12 months. That's kind of the scenario that we're working off of right now. I hope something changes where that changes, but that's the assumption we have. One of the things, and I wish I could say this was brilliant foresight, it's a little bit of luck, but one of the things we've always pushed ourselves to do is to do some out-of-the-box activity every year to prepare for something. So fortunately for us in 2019, as we were preparing for 20, we said, hey, let's do a virtual exam construction meeting because we may need to do that at some point. Now, we didn't anticipate COVID, and we also didn't anticipate, so we agreed to do that. So that was good. So we had thought about that. That was applicable. We figured one specialty. We didn't figure we were going to have to do that across the whole enterprise. So, but again, I think pushing each year to say, let's do something a little out of the box is helpful. Something we just did this week, we haven't even issued it yet. I work with our management team. We're going to survey our people and ask them how they're doing in terms of what they need to work better, whether that's flexibility, in terms of, and that was always kind of there, but again, not with an eye towards this is going to pass in 3-4 weeks or 3-4 months. This was an eye towards, okay, this may be another 6 to 12 months. What do you need? And what are issues? Is the communication rate? Is the touch base? Is the touch points appropriate? So that's kind of the stuff that we're thinking about. We're going to actually survey our whole staff. And I think what we're going to find is each department we have is going to have slightly different needs, and that'll help inform what we do in the future. At least I hope it will.
And Bill, just to clarify, when you're talking about the surveys, it sounds like you're going to survey the whole staff. Were you also surveying your certificant body, your stakeholders, other stakeholders, your certificants, or were you focused more internally on what your staff needs?
Well, that's currently focused internally, but at the management team level, that's part of our discussions when we get together, say, what are our customer needs We already made some changes this year. We extended testing windows. We applied for the exemption under NCCA for live remote proctoring. So some of those things are part of what our management team is tasked. Let's look at the data and see, let's be customer centric and see what those needs are. We're having those discussions now to help inform that. So we're not going to survey for that. We are going to take the data points and discuss it. We are focusing on our people with this survey and the internal staff. Now that may change, but that's where we're at as of today.
Sure. And Tammy, over to you and Intelios. Based on what you've learned from the reaction and your addressing the different disruptions that have resulted from COVID, how has that informed your future plans, and what are you prioritizing now?
So for us, we're really looking to see what are other, so similar to Bill, it's, now that we realize we're going to be in this in much longer terms than we initially had thought, we are looking to see, what are other systems that we have in place that might be a little more manual, that we need to move into, whether it's cloud-based or an electronic format or in some other space, so that if we're not physically in an office, we're still able to carry out those deeds. I think the other thing for us is looking at the policies that we have in place, so that's another space where we are. So if we're going to be in this environment longer, we need to look at the policies we have in place to see if they still make sense in this new virtual environment. And then the last thing, which is probably the thing for all that, I think the planning and things, for all the things you can expect, there's so much that's unexpected. And, the one thing this environment has shown is the resilience of people from a staff perspective and the ability for people to adapt and be nimble, but it also showed the amount of strain sometimes that the change in this type of environment can give on staff. And so one of the areas that we're also looking at is how else can we continue to support our staff? So right now we have, a high population of staff members who have kids at home and other family members at home. And to the point that you made, I think earlier, Cynthia, it's one thing when you work remotely by yourself. It's another thing when you're working remotely and your spouse is at home, or maybe your parents are there, or your kids are there. And, oh, by the way, you got to teach your kids at the same time, because let's not even start about schools right now. So anyway,
let's not even go there. Tammy.
Let's not even go there. That would be a whole nother conversation. But that does take an emotional strain. And so we've been surveying our staff, and we're actually in the midst of our second survey now with staff to see, what are some of the barriers that staff are having now that they're at home. What are some of the resources that they need? Because again, when I thought I was only going to be in this space for a month or two, it's okay that I'm working on like my kitchen table. But if I'm going to be in it now for 6 months or a year, the kitchen table doesn't work as well. And so, what are resources that maybe we as an organization can help staff so that they can better, kind of make their workspace work? So those are the areas that we're really focusing on through the information we get from our surveys and with our management team.
Sure. And PTCB, I'll ask you to comment on the same question.
Yeah, so I think, again, I'd echo what Bill and Tammy said for sure. And I mentioned this a little bit in my first response, but I think what we figured out went well and was really helpful was focusing on our certificates. Again, it kind of kept us, it gave us a little bit of perspective. And so as it became apparent that we were, going to move to remote proctoring, we looked at everything and we, took a guess about how many people might take advantage of that. And we realized that we were going to make more money off of this potentially because it costs a little bit less sometimes for remote proctoring. So we dropped our prices across the board for certification because it seemed really, really wrong to do better coming out of, a crisis. And I think, I was a little bit disappointed, and this is a negative in myself, in that it felt like we were reacting. And I know things were happening fast, but when Pearson VUE closed the testing centers, and of course I don't begrudge them for doing that, they needed to, I had not anticipated that happening before it happened. And so I think that's definitely something we learned from, again, thinking creatively about what's the worst case scenario and kind of at least having a rough plan for it. And then again, we felt really good about our staff transitioning and the infrastructure that we had in place. What we had not really thought about enough, I think, was our vendors. You know, Bill talked about the supply chain a little bit earlier. If, you know, let's use two sponsors. I'm expecting a check after this, but, you know, if Pearson VUE had not been responsive, or if, you know, we work with Cobalt for our certification management system, if they had moved into a crisis, our crisis could have become an apocalypse. And specifically our customer service vendor, because of the volume, we have a contact center that's out in California and some of the Midwest. If they had not been able to transition to remote work, that would have absolutely been an apocalypse for us. So that's, again, for the next time, and, you know, God willing, there is no next time for a while. We need to be ready for something like that and remember our vendors too.
Sure. So I want to continue this discussion around our service providers and that idea of the supply chain and what we rely on from our partners. And certainly invite other participants in the chat feature to share comments about any issues or recommendations or situations, questions that you have about the idea of the supply chain management. Bill Schimmel, I hear your point around the idea of reaction. You know, in some cases, I feel just as we get a hold of something, there's another thing to react to. And that probably happens more frequently in life than we realize, but it really was amplified, and it has been amplified for the last few months. I feel like we're just in we're reacting to something, and I like that proactive approach. So that certainly weighs heavy on me. But let's talk about the supply chain and our service providers and partners. You know, PTCB, you guys have mentioned a couple times having the idea of continuity in the service that your staff needs to happen, for your candidates to test, for that to all happen. So could you expand a little bit on, you know, what maybe either what you've experienced or how what you've experienced is kind of shaping the future as you look at potential partners? What are you looking for? What conversations are you having with your partners to make sure that you can react quickly or you can be proactive?
Yeah, I'll speak a little bit
to
that one. So it was definitely helpful, and maybe this is obvious, is having a good relationship with those vendors. And I don't mean that so much contractually or professionally even, but personally. It was very helpful in some of those personal relationships to, at least it felt like, get quicker access to information in some cases. You know, I would also say that, you know, this is beyond control, right? But our size as an organization was also helpful in some regards in terms of where that put us in the line of priorities. I can imagine that for smaller programs, it's a little more difficult to, you know, get the ear of the vendor who may be, you know, their only hope, right, for being able to administer exams. You know, so. But yeah, if we, Cynthia, if we want to go on and talk more generally about vendors, I'm happy to do that. But if you'd like to kind of stay on this topic a little bit and take questions from the audience, that's fine. I just don't want to jump around in the order here too much from what was prepared.
Sure. No, I don't see any questions in the chat feature right now. Bill Ellis, I see that you do have a comment. So why don't we open it up to Bill at BPS, and then Levi, if you have some other general comments, feel free to add those in.
So to add to what Levi said, and I know this is really going to sound cliche, but I think this pandemic and this crisis has highlighted it, that the criticality of communication just can't be understated. You've got to be able to communicate. And then, you know, this is also going to sound cliche about trust and openness. I've said to vendors, listen, if you can't do something, just tell us and we'll figure out how to work around it. I think sometimes in the vendor-buyer relationship, vendors feel this pressure to have to do everything. And it's just not humanly possible. So I'd rather have a vendor say, we can't do this, And, listen, we can discuss why and whether that's valid or not. But listen, if you can't do it, I'd rather know, because then we will work with you to address the issue. So I think issues around communication and trust is really, really key. And I think this crisis has kind of brought that to bear.
Sure. And Tammy, what about from your perspective at Intelios? What, and maybe it wasn't even vendors or service providers for only your candidates and exam development, kind of the ones we always think about in certification, but other service providers that were meeting the needs of your operations. What were some challenges that you faced, and what are you kind of looking to in the future as you consider future planning to handle disruptions?
So I think the one thing is that, with all of our service providers, we were, just like with everybody else, we were in a unique situation where we were all going through the same thing at the same time. And, that's not always the case. And as such, to Bill's point, and I think Levi's point earlier, the communication just became critical, and having the relationships with all of them became critical, because it involved pivoting in many spaces. It also involved thinking about ideas or moving up things like, even on the exam development side, we had been talking about remote proctoring, but it was, it was in the future. And in the future became like today. And so, I think just having vendors and having relationships with people where they're willing to grow and move with you, and that they also have, nimble enough organizations that they can help you think about things that maybe you're not even thinking about, and that they're at least willing to think about things that are not just in the traditional space and area that you may have been, working with. That's what, as we look for vendors and as we continue to work with people going forward, kind of the thing taken is that we need people who are going to be there with us when we're on worst case scenario, and right now we feel like this is what worst case scenario looks like, but it may not be. And so,
let's hope.
Yes, I know.
Let's hope that this is worst case.
Yes, at least for a while. At least for a while.
For a while. Yes. I think everyone needs a little break.
Yes.
I think you all mentioned the demand. It wasn't, we have all these groups and they're going to want remote proctoring and some nice phased in approach. It was, it's March, this happens, testing centers closed, we need this up and running now. So the demand on our service providers and our partners that support that side of our certification programs certainly was severe and very fast. So if there are other service providers on the call, feel free to chime in the chat box on any challenges or advice that you have for certification boards from your perspective of what could have made that easier. I think the communication piece is really key in managing realistic expectations and realistic timeframes for how to move forward and be reactive or proactive. So let me switch gears, not significantly, but a bit, and talk about decision making. A lot of the work that my organization does is in accreditation compliance. So we're constantly looking at approval of policy and making sure there's rationale and there's a clear decision-making tree, and that policy approval is all documented. And Bill, both Bills, I think you've mentioned, we were making decisions very quickly. I'm gonna take a leap here and say that perhaps this is not true for everyone, but sometimes going through a traditional governance model in our setup, in our association certification board type model, can take some time. It's not always swift decision making. So how was this an issue for you all, that idea of we have to be reactive and we have to be very quick in reacting to this? And how did you handle that? And I'll start with PTCB.
Yeah, we were, I guess you'd call it lucky in that if you recall back in 2017, Hurricane Harvey was pretty terrible and devastating. And that wasn't the, and several years prior to that was other pretty impactful storms. And so as a result of that, as a management team, we thought about, how can we really, be implementing changes quickly enough to meet needs. So we worked with, and in our governance, we have our volunteer certification council, which is our policy setting body, and then we have a board of governors, which is, has the fiduciary responsibility. So we have those two groups for some things that we have to work with. And, we developed a policy that we call it our disaster relief policy, but essentially it was meant to, and we've used it to fast track a very limited kinds of reaction to any kind of, we would call it disaster, but it could be any kind of disruption here. And what it allows us to do is go to just the leadership, chair, vice chair, if you will, of our certification council, and working with our CEO to implement things. But there are limits on that, right? So they can't absolve anybody of a certification requirement, but it does allow us to implement flexibility in deadlines, as well as some pricing. And Bill had mentioned we did make an adjustment to our pricing to lower our pricing as a result of this. And then also, we had candidates authorized to test. For us, that has a 90-day expiration on it. So we had a lot of folks who we had to extend those deadlines for. And then we also had a number due to recertify, and had to consider being frontline healthcare workers. Essentially, what is their ability to complete their obligations in the same time frame to meet recertification requirements, and then to actually go through the process of applying. So those were extended as well. But to maintain, still what we think is good governance, right? Those decisions, they're limited. It's stated clearly in a policy what can and can't be made, and then those have to get reported back to our two groups, so that there's that level of transparency.
And Levi or Bill, I'm assuming the answer to this is yes, but was that policy, having that in effect, was that helpful? And did you use the allowance of that policy within COVID to make those quick decisions?
Yes, absolutely. We did lean on that policy and implement extensions of deadlines and things like that pretty quickly, much more quickly than we were able to figure out what we were going to do with test administration long-term and things like that. So, okay.
Was there, not to harp on this, but was there any, when you established that policy in response to the natural disaster at the time, the hurricane, was there any concern from staff or leadership that, hey, is this the right thing? Or were they pretty much on board with the idea of we need to have this ability to execute faster?
Yeah, there were significant conversations around limits, right? This was not supposed to be, nor did it turn out to be, thankfully, carte blanche for our CEO to, suspend fees or just make things easier for people because of any, or for this ability to be abused in any fashion. So most of those conversations were around placing those guardrails in there, and that's what we ended up with.
Great. Tammy, how about your organization? Again, what was the model like? Did you have to speed up the decision making? How did that happen? And then are you looking to make any changes to that in the future?
So fortunately, we were in a place where with our board and councils, we the kind of liaison. So Dale, our CEO, who primarily meets with our board, and then our chief assessment officer, who meets with our council chairs and vice chairs. They were already having regular meetings, and like with the board chair, for example, Dale's meeting with them every week. And so when you're having those types of meetings already in place, the ability to add another one sometimes became not a problem at all. So we've been really fortunate in that anytime we need to make a decision, our executive committee for our board or our councils have been able to quickly be available and based off of the communication schemes we've already had. And then part of it too for us, I think that's been helpful is that as we've been going along and kind of learning and adjusting, and so some of that's through articles that we're reading and information that we're gaining, we're sending that to our governance leadership as well, so that they can see the trends that we're seeing, so that they can see, where we're getting the data for our information, so that when we get on the call with them, it's not like they're coming into it cold, but rather that they're starting from the same or similar educational space that, that we are.
Mm-hmm. And how about BPS, Bill?
So this is a really good discussion. I think it highlights the value of thinking about governance issues in general. If you're an accredited program, you obviously have to think about governance issues. And I know, Cynthia, you do a lot of consulting in this area with groups that have already talked about governance. And a crisis brings that to light more quickly. In our case, it's relatively simple, and it actually validated a shift we made a few years ago. So we actually have monthly board calls. So they're just 1 hour touch base. So the good news was we had a monthly infrastructure in place. We also have the ability, similar to PTCB, where an executive committee can make decisions on an emergency basis. And they know going into the beginning of the year that they've got to really be responsive, because if we have to make a decision quickly, and then we just report out at each board meeting, these are actions taken in between. So again, it goes back to the value of communication and that structure. So, but it is important, governance is one of those things. If things have been going along well, you tend not to think about it because it's not broken, you don't fix it. But you do have to think about these scenarios and how would a governance model hold up.
Yeah, and I'm going to go a little off script, panelists. I apologize. But did anyone have an issue? You're all working in healthcare at organizations that serve the healthcare industry. We may get to this a little bit more detail when we talk about exam development SMEs, but at the leadership level, was there an issue with the availability of your governing body members because they were on front lines or they were pulled into the day-to-day job? And coming from a healthcare perspective, which I realize not all of our participants are from, but many do represent healthcare or allied healthcare fields, was there any issue with actually their availability to participate, or is that not really something you had to deal with?
So we've had issues with some of our board, some of our members being accessible because of in the medical imaging sonography, in that space, being on those front lines and not being available, at least at a particular time. But the one thing that in those situations, we've just found other ways to ensure that they are obviously up to date and to get their feedback. So that might be responding in an email versus being on a call, or, doing something a little differently just to make sure, obviously, that they're still up to date and informed.
Sure. Any other thoughts?
Yeah, I guess I would say for PTCB, we've been okay for the most part. I mean, in some ways it helps when you're not going anywhere. Nobody's going anywhere in a lot of ways. So you can, from a staff perspective, if you need to be more flexible to allow for, more challenging schedules for folks who are going into, a healthcare facility every day, then that helps. But I know Levi's had to probably work a little bit harder to get quorums in a couple of those governance meetings. But for the most part, people, again, they know how important their role is, both working every day and as a volunteer, and it's been pretty good for us.
Okay. I see a couple comments in our chat looking at policy changes being discussed at the staff level, but also at among volunteer leaders to consider legal risk impacts, any regulatory issues. So kind of along that idea of making exceptions to a policy, it can be possible certainly in reaction to these types of issues, but having a rationale to document that, getting the approval of the larger governing body, make sure that everyone's aware of that, and then certainly considering the reaction that you need to have and how long that exception may be in place, and how is that transitioning back into regular practice? When does that happen? So let's switch gears again and talk a little bit about, kind of dive more into the details around, your staff. Tammy, you mentioned in your introductory comments that there was, helping people get used to working in a virtual environment, making sure they had the tools. We heard from some other comments around, remote work for a few days, telecommuting. We were all set up for that, but what does that mean in a longer term when we're doing this for weeks or months or longer at a time? So what did you find that your staff needed? Was there training that you needed to provide them, additional skills you needed to focus on? Talk to us a little bit about your staff at Intelios and how you had to really address their needs.
So, I have to say, holistically, our staff did really well, considering that the majority of our staff was not remote and most of them were coming into the office every day. I feel like that initial transition went as well as I think it could have probably gone. That being said, I also realized that there came a point so we went March 16th was, like many, was the first day that we really went into this full remote standing. We have a monthly meeting that we have, a monthly staff meeting that we have with our staff. And it was probably March, April, the May meeting when we started to realize that people just seemed different. And, we could kind of see the fatigue starting to hit people. And, for us, it really then became around and messaging that we were sending to not only our staff, but even reminding ourselves. It's, things such as reminding people to take time off. I know that sounds crazy in this environment because well, where am I going to go? But at the same time, the one thing that we started to notice, and our survey proved this to be true, is people were just having such a hard time disconnecting from and making the transition from home to work. If you think about it before, if you were physically going someplace, there were boundaries. Even if you were working remotely, at a certain time, your kids came home from school, or if something happened that made you make that switch from I'm working to now I'm at home doing, things, I'm driving in my car, whatever that is. Most people aren't finding that now. And because of that, people are on a lot more than what they were previously. And people were having more meetings, and you're sitting in, well, this is WebEx, but I was going to say Zoom, but Zoom, WebEx, you're sitting in some virtual meeting, all day long. And even though you may have been in the same number of meetings before all of this happened, the thing of it is at least you were moving at some point. For most of our staff, you were moving from one conference room to another. I'm moving from my office to somebody else's office. Now I'm just sitting in the same spot for however many hours in a day. And so when we started really realizing that we were going to be in this longer and starting to see people just get tired from all of that, we really started pushing this idea of taking time off, taking breaks, going for a walk in the middle of the day. So for us, it was reminding people about kind of the scheduling of things, setting routines and setting schedules, which sounds, it's not rocket science. Like, it's not like, oh my gosh, that's the best. I've never heard that before. Like, it's not that, but we need to be reminded of that, especially, in these environments. And then we really started to also talk about this idea of, people being resilient and people being empathetic and people not being so hard on themselves, like our staff not being so hard on themselves, because at this point in time, we are all dealing with something that most of us have never dealt with in our lives, before. And everybody is dealing with it. And it's okay to not feel okay. And so we've been really pushing our employee assistance program that we have and telling staff, like, look, if you feel it's okay, if you need to talk, we have this designed for you. Please go talk to them. We're doing more articles and pushing more articles and things to staff on just mindfulness and those things that, can help people feel hopefully more centered and balanced. And then we're looking to start doing some sessions with outside vendors who can come and talk to us to help, because again, I think we're going to be in this space for longer than any of us ever anticipated.
Mm-hmm. Yeah, I think one challenge that I anticipate some people might have is the idea of, for my team, we don't have a full-time person that handles, kind of HR. Our chief people person, that role doesn't really exist necessarily. We farm some of that out. So we really started to look at outside sources. You know, there's so much information available, and how can we take care of our people and have those check-ins and, you know, make sure that they're able to take care of their families, that they were taking care of themselves, and they knew that there was some coverage in place if they needed to take that time. So Bill Ellis, let me switch over to you on that kind of concept of, you know, if you have staff that are, you know, certainly in any environment, we're thinking about cross-training and making sure that the skills, you know, we don't want it to be a pandemic, but maybe it's I hear people say, you know, they won the lottery and the whole team goes away or a group of people go away. That idea of cross-training and making sure that operationally the tactical elements that need to happen, we've talked very big picture about, you know, managing your service providers and having disaster plans, but on some level, it's very tactical, the steps we need to take to process applications and get our candidates through the pipeline. So what kind of, you know, what did you have in place already, and what are you thinking about for as we move forward in this to make sure that that continuity of your staff's work is in place?
So, you know, this gets to the value. You know, people look at accreditation in different ways, but one of the values of us going through accreditation is we have a quality management system in place that's part of ISO 17024 requirements. So we've documented all that stuff. Is it a lot of work? It's a lot of work, and it's not a lot of fun, but it has really shown to be valuable. The idea, to your point, Cynthia, about cross-training is important in a very practical way, because you need to support each other. You know, somebody may have a family issue that comes up and somebody needs to jump in. So I think there's sort of that real technical side to your point about having things really well documented in workflows. And I can tell you some of the things that we've learned as we had to develop those workflows over the years, that not everybody always approached the work the same way. And that actually led to some really good discussions about, well, what's the best way to do this? And what's the most consistent way to do it? So yeah, I think documentation is important, never fun, not one of my most fun things to do, but I think is valuable. Going forward. And then, like I said, I also think that there's another value in cross-training, not only in crisis, it's walking a mile in someone else's shoes, which I think has helped people better understand what other parts of the organization do and what's involved. So there's a lot of positives that can come out of these kinds of things. So that's just a couple of things that come to mind from my perspective.
Great, thank you. And PTCB, what about your staff, and how are you meeting their needs or refining skill sets to help meet the needs of the operations of your program?
Yeah, so honestly, I wouldn't say we've made any big changes there. I know we're going to talk a little bit later about, you know, the day-to-day and how we're keeping in touch and working on culture. But I think it's really important, and I think we've tried really hard to do this, is to just kind of build that culture where, you know, that give and take is there, that we're going to be really, really flexible with the team, and in return, you get really, really good work out of that. And I think we saw that, and I think everybody kind of stepped up, and that was really great. And I think, you know, we had that culture, and then you had to take it a step further because of everything that was happening. And then kind of layer on that compassion that, yeah, what if they are caring for a family member, or what if they have small children? And then maybe it helps that during your first, you know, all staff meeting after everybody starts working from home, that, you know, the CEO has to leave the meeting because one of his children is stuck in a tree. So, I mean, you signal that compassion that, you know, we're all in this together, and some of that helps. And that did happen. I think it's happened like 3 times. People just get stuck in trees in my neighborhood. So, yeah, I mean, for the most part, I think I mean, that kind of having that culture going in might be the most important thing.
Great. So let me pause for just one moment to say I do see some of our chat activity around a very large looming question, perhaps, you know, kind of the elephant in the room on, you know, that organizations are taking big hits in their certificate numbers, and the scenario and planning around that for groups that might have no testing if they've done, you know, kind of one administration in a face-to-face environment. I certainly don't want to overlook the importance of that, and we can come back to that topic when we have some time at the end, which I think we will have. And I'll ask our panelists for kind of shifting our focus from we're kind of working under the assumption on internally operating the programs, kind of leaving off that big elephant in the room of everybody's kind of dealing with perhaps down numbers, financial issues with their programs, survival of different programs. I don't want to gloss over that in any way. I certainly understand that is a large issue, and we can come back and ask our panelists about that at the end of our Q&A. But for now, I'm going to keep us focused on our staff and how we're taking care of that. Tammy and Bill from PTCB, you both mentioned kind of this culture question, which, you know, maybe we don't think about as much, but that social interaction, I know when I first started working at home, I wasn't nearly as busy and my social interactions were dramatically different. And I remember just craving that time when you had 5 minutes after a meeting and you would catch up or hear about someone's family or their friends or something they did in their personal life. And that was a really big adjustment for me when I first started working at home, was that day-to-day interaction. And I imagine many people have felt that. So in terms of the culture, you have all worked very hard to build internally on your staff in a face-to-face environment or some kind of hybrid environment. How are you replicating that, and what are you trying to do to keep that going?
So,
and Tammy, we'll start with you. Go ahead.
Okay, so for us, you know, we're doing weekly town halls, which our CEO leads, which really is just a Q&A. So it gives him an opportunity to give a few minutes, and normally it's under 5 minutes, kind of update on the state of how the organization is doing or how it's done in the last week. But also it gives staff an opportunity to ask any question that they want about where things are. Sometimes we literally just sit there and people talk about what they did the last weekend. So it's a very informal way for staff who it's completely voluntary. So not everybody obviously is there all the time, but it's a way for us to just kind of get a pulse for how people are doing and what's impacting people. You know, one week we had a lady who came on because she was so excited. She finally got a desk. Like, she was like, I've been working. She was my example. She was like, I've been working on my kitchen table all this time, and now I have a desk. And like, literally, we're on there celebrating that this woman got a desk. You know, I mean, so it really is that informal, but I think it's very necessary. We also have a group of staff who do a lot of community building events for us. And so at least once a month, this group, our community engagement group, they come together and they're doing, like, we've done online Jeopardy, they've done talent shows. We've had events where kids, like we did a tour of Disney World, that somebody put together this slide deck of Disney World, which I know most people on here will not know, but for those who, Intellios people who are on here knows, I'm a huge Disney fan. So so anything Disney already captures me, but it really, and they made it into a game, and we included the family of the people who were there, because we're not going to be able to have our staff picnic this year because, well, we're in this, you know, state. And so there was a ice sculpting event that happened online. So, you know, we are continuing to try and maintain the culture through different activities, through different Zoom channels. We have a Zoom trivia channel where people just randomly throw up trivia questions and people ask. So if nothing else, it gives you a little bit of a break during the course of the day. There's a lot more check-in. So I'm hearing, you know, a lot more people are just randomly checking in with people. And not only are they checking in with people that they normally would check in with, but they're also checking in with people that they weren't before. And I think that's really helped from a cultural standpoint to help people understand and get to know their staff a little bit more. And that's something we will continue, that, you know, especially if we're going to be in, not if, as we will be in this longer than, again, we had anticipated, we are going to continue to find ways to build up and maintain the culture, you know, that we have.
Sure. I love the trivia idea. I'm thinking how we can do a CNG trivia session, perhaps. Let's kick it over to Bill Ellis. Any thoughts that, I believe you said your staff was about 19, 20 people. Is that more manageable? How have you been able to keep your culture and meet those needs of your staff?
Well, I think there are certain principles to Tammy's point that cut across all this. And I guess the thing that I'm reading and hearing about that ties into her points is, we started using this term initially, social distancing. And as we get into month 6 or 7, maybe we need to stop using the term social distancing and talk about physical distancing and figure out ways to maintain social contacts. Because that's one thing for a couple of weeks. It's another thing for months or a year. So I know that sounds really philosophical, but I think that's a lens I'm trying to use to say, okay, we have to be physically separated, but how can we connect socially and professionally? Within our staff, I've seen a shift too from the early days. My manager, we met 3 days a week. And we're not doing that anymore now because we've kind of adjusted. So we've backed off of that. I think form has to follow function. And a lot of the early stuff that I was reading that I'm sure we already know, communicate, you got to meet all the time. I think we're at a point now in month 5 or 6 where we've got to assess that. So we have our departments that do meet weekly. I meet with the management team weekly, and we have our all staff with 19 people that meet, every other week. So again, your organization, you've got to see what works best. But what I do think about a little bit more now is sort of how do we create space for people to stay connected, maybe in a more informal way, because that's kind of where we're going to be, and it highlights the value of some of the social interactions that actually take place in the workplace. And so I just don't want to see us lose that, which I think is kind of the point Tammy was making.
Sure. And PTCB? Oh, sorry. Go ahead.
I was just going to say, just off of Bill's point, because I think it fits well right here, is that I don't know how many organizations that are on the line right now where everybody is still fully remote. And so some organizations may have started allowing their staff to go back into the office. And so I do think that the considerations and the empathy and the things that you were showing when everybody was universally on the same level by all accounts, meaning everybody was fully remote, versus if some now are remote and some are back in the office, that those things continue to be extended as organizations are starting to reopen some. Sorry, I didn't mean to interrupt.
No, that's okay. Thank you. And PTCB, what are you doing with your staff, and how is this, what challenges or what opportunities have you been able to take advantage of to kind of maintain that culture and that interaction?
Yeah, really similar to, I'll be quick to what Tammy said. We're a smaller staff, so we don't have full-time human resources, but because we had so many folks that are full-time remote, we've been kind of making an effort across the past 18 months to do different things to help them stay connected to the people who are going into the office every day. So, some of those efforts by that small team, we call them the care team, they essentially just made them weekly. And so, yeah, now we have a weekly all-staff meeting, and anyone who knows me knows I did not like having all-staff meetings in our past life. We did them about every 2 months, maybe, but now they're every week, and they are as much social as they are interacting and question and answer. And so there's really 30 minutes of the all-staff part and 30 minutes of social. And then some other things kind of outside of that we have, going on. We have a weekly wellness thing we've been doing for the summer, where it's very easy to earn points with some incentives built into it. Again, to try and make sure people are not just huddling only in their house, where possible, where you can do it safely. But yeah, almost exactly what Tammy described is kind of how we moved to it. I think it's going pretty well.
Great. Well, Levi, I'll give you a heads up. I'm about to put you on the spot here about some exam development activities and how that's being handled in your role with PTCB. We've talked a lot about, taking care of our people, mostly focused on our staff, our relationships with our vendors and our partners, and kind of managing those relationships. But we also have this other big group of people, and those are our volunteers. We talked a little bit about our leadership, those volunteer leaders, but we also have, our SMEs who are often meeting very much in a face-to-face environment. We rely on them heavily for exam development activities, and the inability to have a sufficient pool of SMEs causes a significant challenge to the quality of our programs and being able to do the activities that we need to do. So let's talk a little bit about that. I know I've attended a lot of sessions at various conferences around virtual item development versus face-to-face. You know, people trying to do that virtual better. It's easier, it's faster, it's cheaper. I still hear a lot of people say there's a lot of value in that face-to-face SME meeting. So how, you know, obviously in this environment, we're not doing those meetings. So how are you managing that? You know, initially, what was the reaction from PTCB with anything that you had planned on the books? And what are you doing moving forward?
Yeah, happy to talk about volunteers at this point because, you know, for staff, I mean, we get paid. So even if things are disrupted and inconvenient, you know, that's, we can't really complain too much, right? But, you know, for us, I think Bill mentioned we're a staff of 30 some odd, but when you include the volunteers that we work with on an annual basis at some level, we're talking about another 100 people for us, give or take. So it's really huge. And, you know, these people, their incentives for participating are very, very different. And, you know, we know that from talking to these volunteers, they love the, you know, the professional development aspect of interacting with others in their field, right? From as we bring people at meetings, obviously from all over the country, and you know, to lose that is a, you know, is definitely a negative, right? Now, for us in working with our volunteers, I mean, we have a lot of things that were in place foundationally, right? We have a cloud-based item bank, and most of our volunteers were used to some level of interacting remotely, although it has not gone until recently to this full virtual meeting kind of a format. It's more, hey, you know, following this in-person meeting, let's work on this, that, and the other as a follow-up. You know, that's how a lot of our item writing has happened recently. And in fact, before the pandemic this year, we were planning to actually do some more in-person activities, essentially to pull back from some of the remote around item writing, at least, because we've noticed that, you know, there are some more efficiencies to be gained from our perspective, depending on the, you know, the goal, what you're trying to get out of a particular item writing campaign. But we, you know, we were planning to do that, and had to pull back from that. So it was kind of this weird, you're moving forward, you're moving backward, kind of, you know, what are you doing? But thankfully, you know, our volunteers at least, you know, are just super dedicated because they're passionate about their field. I can't imagine that's unique to us, right? But even knowing that going into this year that, you know, we had to inform them meetings are getting canceled, you know, we're going to have to do this remotely. You know, there may have been a little bit of sighing on the side, but really we didn't experience too much of that. It was kind of like, okay, well, here's what I can do. And kind of spying in the chat, you know, some conversation I saw going on earlier about, you know, maybe healthcare has it a little bit easier in these times. I think, you know, for certifiers of healthcare workers, maybe financially that's true, but we know that the impact on our volunteers is as significant, even though it plays out a little bit differently, right? There's a need for healthcare workers, but even amongst our volunteers, we hear stories about, oh, well, you know, my hours are getting cut or my schedule is getting moved around. And that's all on top of the fact that you're in a role where you're, you know, potentially very exposed to what's going on. So, you know, to sort of come back on what we did practically for this year, you know, we had a number of meetings scheduled that were supposed to be in person, and we had to rethink how to pull off a meeting like that in a virtual setting. And typically we'd kind of compartmentalize, well, we think this type of activity can work well remotely for various reasons. And it really comes down to the information that we feel is necessary, you know, to do the activity, right? In person, it's very, very easy to provide a very information-rich environment, right? There's information from those who are facilitating the meeting, some of our internal content development people, right? There's the others in the group, the other volunteers, and then there's all sorts of other resources, right? When you're writing items, there's the platform that's capturing the items themselves. There's ancillary resources that are needed to, for for example, to support the key that you're doing, whatever. And so it became really a kind of a challenge to think through how you duplicate that information-rich environment in this very flat, sort of one person can speak at a time kind of a format, right? That's not the way development meetings usually work for us. If there's one person only talking, that's, maybe that's more the rarity. And so what we ended up doing was really having to make quite a big shift in terms of chunking up the time. So if it was supposed to be a one-day meeting, it's really unfair to have somebody, as a volunteer sitting in front of their computer for an hour, for hours on end for a whole day. So we've had to kind of split things up and then also give a lot of care to how we're providing information. Like as staff, it's easy to support staff with having, I don't know, you need a second monitor or you need access to a printer, things like that. It's very difficult to do that for our volunteers. So we needed to really figure out, how can we make the task smaller in the sense that the information will still be available there, and we just have to do kind of more of these things to build up to what we want to do. And I'll pause there probably and let the other panelists respond as well.
Great, thank you. It was very helpful. Tammy, I believe, I'm going to take a leap here, that you're in your role as Chief People Officer, you're also working with your volunteers as well. Not sure how deep that goes with the SMEs, but how has this been addressed by Intelios?
So a lot of things were similar to what Levi said, so probably will be short in that, events that we had spanning over multiple days, we absolutely have separated and segmented so that they are, a few hours at any given time. Also, because we do have a lot of our SMEs are, they're sonographers, and so they're out there and they're on the front lines. And so, but as such, we had to be more nimble about timing and being more flexible in terms of, do we do it first in the morning? Do we do it later in the evening? What does that time look like? Also getting people used to just the technology. So I know it sounds kind of crazy, but not everybody's on WebEx or Zoom or some virtual chat all day long. And so when that's not your normal, you have to also allow time for people to get comfortable so that, I'm not just seeing your forehead, but I'm seeing your full face, and all the technology things that I think sometimes we take for granted because we do it all the time.
Yeah, it's that SNL skit, I think, about how to do a Zoom call where the camera, your face is in and out. So, yeah.
Yes.
How about BPS, Bill? What were, some of with 13 programs, I think you said, is that a more robust schedule that you're now moving around? What does that look like for you?
Well, listen, they're all separate specialties, so I think they operate to themselves. But, for our staff, they have to service all those. So I'm going to take a little different approach here, too, and say that one of the things that's come out of this, in addition to all the virtual stuff that we do, is it's reinforced the value of the face-to-face interaction. And one of the things that I worry about a little bit is we got to figure out a way to get back to that at some point, because that's the quote-unquote payment that these volunteers and subject matter experts get. It's a chance to collaborate with their peers, commiserate with their peers. And so how do we kind of make that work? I know we use a calendar budget. So for next year, not knowing when this is over, I'm going to build in at least one face-to-face meeting. I hope we're able to do it. And then I'm challenging our staff to say, what for each of these 13 specialties do you think the most valuable face-to-face time would be? And let's figure out how we put that in, because they've all made it loud and clear that they value that. So just because you've made it work virtually, I would caution groups, at least this is how we're approaching it, just to say, well, because we did virtually, everything's just going to be virtual and be done with it. So something to think about or consider as you move forward.
Yeah, more of a balance of perhaps we're integrating more virtual development, but keeping a balance with some type of face-to-face interaction. And I know for some of our groups that we work with that have, specifically that are working with much smaller staff and volumes, they often will tag on exam development activities with their SMEs to a national conference or existing industry activities that their SMEs may already be going to, so that the kind of logistical costs of those go down because they're already there. or maybe it's not quite as much of a burden. And of course, with conferences being canceled, I saw in the chat, somebody, Buck, I think it was, said all the conferences have been canceled in 2020. That certainly hurts that ability. And then certainly the ask of the SMEs. I definitely hear the points around chunking up some of the time commitments. I think doing an all day is really hard. We have you on the calendar for 2 hours today, and that's probably at the end of this 2 hours, you all are going to be very excited for a break from your computer screens, but also balancing that with the availability of your test development teams that are running those meetings, and how is that getting managed? It's sometimes easier for me personally to block off a whole day rather than, I'm looking at 2 hour chunks and balancing that across multiple clients or programs. And so that's certainly a challenge. Any other thoughts before we leave this topic of exam development and management of the SMEs?
Just one other quick thing. Sure. It's sort of tangentially related, is that because of the hit we've taken in test admin volume, right? This presented an interesting challenge because it kind of threw off all of our assumptions about exposure and what our publication schedule was like. So at the same time that we're trying to figure out how to change these meetings into this online format, we're also trying to figure out the timing of those meetings themselves and how long we're going to run certain test forms, which is maybe a little bit of that is maybe idiosyncratic to us. But it was interesting that, we had gotten, our test volume had been very reliable and very comfortable. So that let us plan out, in this part of the year we do X, and later part of the year we do Y, and it's all very predictable. And that part of the planning got thrown into chaos as well.
Mm-hmm. Another place that you had to react, it sounds like. Yeah. So let me go to, we have one more planned question, which is, I'm going to actually leave that till the end. There's a couple of items that came up in the chat that I want to touch on. And one of those is looking at is staff layoffs, layoffs or furloughs. And if that was done on your team, how has that been managed from a communication standpoint, or any information you want to share on that if you can. But then also looking at if there hasn't been a furlough or a layoff period, has that kind of job security resulted in a more positive work environment for your staff? Do you see more positivity coming out versus anxiety around, are we getting furloughed? Are there going to be layoffs? I think Jonna put in the chat from Danby that there was a 20% cut. So thank you for sharing that, Jonna. I invite others on the line to, share any thoughts on this. But let me turn it to our panelists here today and see if anyone wants to jump in on this one on, any kind of managing kind of that anxiety of job security. And if that anxiety isn't there, has that resulted in I would imagine the answer is yes, but I would feel more positive if I knew that wasn't coming down the pipeline. Seems like pretty straightforward, but how have, Tammy, I'll put you on the spot. How have you guys been handling this?
So we haven't had, we fortunately have not had to do any type of job layoffs or any adjustments to our existing staff. Now, we had some positions that we were looking to bring on this year that we've slowed down. So we have slowed down the hiring of some additional positions just so that we can see how, financially things continue to carry out. We've also really, both organically, because for example, we're not traveling as much and certain things aren't happening the way that they were. We have become much more conservative with our expenses. And so we, use that as a way to manage things. And I do think, so again, we've surveyed people twice now. We're in the middle of the second survey now. And fortunately, job security has not been something that has been listed as kind of a concern or anything for staff. And that has not come up to this point. So to your question of, does that make people feel a little safer? I think so. I think our CEO having the town hall every week where he talks about and gives financial updates, I think is helpful so that at least people know where we are and where we're standing and what we're doing to manage that in the best way that we can.
Yeah, that idea of transparency and, they have the information is certainly something I've heard from a number of different groups of really being as open and honest as possible with working with what the situation is. Either PTCB or BPS, excuse me, any thoughts on this?
So this is Bill. I've told my staff from the beginning, control what you can control and try not to spend too much time or energy worrying about things that you can't control. Sounds trite, but it's so simple, and it's something that I think I do it, right? You worry about things, and so I find myself catching myself say, hey, can I really control that? And so I think that's the challenge, because listen, I don't, job security, we're talking about a global pandemic and a worldwide economic recession. People have to be worried about that stuff. So they may not be articulating it. I think as leaders, we have to do that. I'm also encouraging our staff, regardless of where you're at on the org chart, lead from your position, because I think what raises people's anxiety is when they feel lack of control. So control what you can, lead from your position. We need that innovation. We need those new ideas. We need the efficiency. So that's how I'm trying to manage. We did lose a position. We have not had catastrophic reduction in revenue or demand, but we did lose a position, and we have people on a 1-week furlough. So, we've had some financial impact, but despite all that, even if we didn't, I think that message for me would still be the same.
Sure. Lead from your position. I like that.
Yeah, from a PTCB perspective, I don't have too much to add. I mean, we're fortunate that we have not had to make, any type of staffing reductions or furloughs or anything like that. I really think it's just something to do with the healthcare nature, and the technicians themselves are very, very busy, and the regulators want them to be certified. A lot of their employers still want them to be certified. So I think that has just helped us out. And so there's value in the credential, I guess, enough that, our volume is okay from that perspective. Now, it's hard to predict the future, but, as you noted, and Tammy noted as well, I mean, just that reassurance from the staff, even virtually, when I made kind of a reassuring announcement a while back, when this first started, you can see kind of a lot of people kind of were holding their breath, and that reassurance was there. But again, as this drags, it's still going to be in the back of people's minds, right? So one thing that we do is we do talk about our volume and our finances a lot on those weekly chats, so that if people hear good news, then they still have some of that confidence. So if you are in that position, I would just remind people of it frequently.
So I see some chats going on around eligibility requirements, and there's definitely some back and forth on that. So I just want to pause and get the perspective of our panelists. Have you changed or lowered eligibility requirements? And if so, how was that defensible? And was it something that one thing I'll add on personally is we talk a lot about, if you're making an exception to the policy, what is the rationale for that, making sure that you're thinking through that, because at the end of that brainstorming thought process around a policy exception, you may find out that in the long term it's going to hurt you more than help you. And then, what is the transition plan to make sure that whoever is impacted by that exception, if it happens, doesn't somehow slip through the cracks or aren't able to become brought back up to where they should have been, let's say. And then how long does it happen, and what is the transition plan of changing that eligibility back to its quote unquote normal place? So let me start with PTCB. Was there any change in eligibility requirements for initial certification? And how did you go through that process? Did you discuss it? Was it something you considered?
Yeah, so we had no changes to our requirements themselves, but at the beginning of the year, we instituted an updated education requirement. And so what we found is that as the pandemic started to hit kind of in the middle to late of the spring semester, if you will, is that a lot of individuals were not able to complete their programs. Okay, so what our efforts have focused on is in really how we are, I guess you'd say, applying that requirement. Since you know, when it was conceived, it was very much like, okay, well, you complete the program and then you're good. But really, what underlies that is certain knowledge and skills that we require are taught in a program. So in a couple of sort of limited cases, we've had and we put together a committee to do this to evaluate whether somebody has completed enough of their program, whereas otherwise they may have been considered, you know, to be at that level of knowledge and skill. So the way we see it, you know, the requirement is still there, but there's both some flexibility in allowing people to complete the program, and in cases where that's become impossible, you know, there is this sort of alternative evaluation, if you will, but it's all consistent with the requirement itself and decisions that our certification council has made. One other thing that I'll just mention, though, because up until recently I served as a public member on a board in a certification organization, completely different industry, right, as would have to be the case. And it was interesting because this did come up for them, and it was quite an important topic because you know, they had a very high bar as an education requirement. And it was not only completion of a formal program, but also these, call them like externship hours that they had to do, where they had to practice under a you know, a certified or licensed professional and gain experience. And a lot of that dried up. And so there were some of the, you know, professional members of that certifying body who were, you know, wanting to make a change, you know, to make it you know, possible for these students to still sort of make it through and stay on their credentialing and career path. And so there were a couple of others of us on that board who had to kind of pull them back and get them to realize, while this pandemic is a perfect opportunity to cause you to reevaluate your requirements, there is, you know, you have to be very mindful about how any change you might want to make is defensible. And if it's just to make things, you know, easier for people, that's not really going to fly. I think in the end, they did determine that outside of the pandemic, that there was some modification that they would make, but there had to be a lot of care taken in that conversation so that what was documented and then what was ultimately approved and communicated, you know, was appropriate and did not have any even appearance of being, you know, a decision that was just made to save testing volume. So that was an interesting thing to be involved in.
Mm-hmm. Yeah. Tammy or Bill Ellis, any thoughts on lowering eligibility requirements?
So our answer is sure. So we have not done anything to lower eligibility requirements. I think obviously as things move forward and we're in this situation longer, I imagine we'll continue to, you know, reassess what makes sense. But at this time, we are not making any changes.
Okay, thank you.
And I would just say, as a general rule, and I'm speaking in generalities here, it's not a good idea to lower your eligibility requirements. If you're an accredited program, that will get you in trouble with the accreditors very quickly. But to Levi's point, if in your own circumstance you feel you need to do that, make sure you have a well thought out, defensible rationale for that, and you communicate that in advance to the accrediting body. I think the area, and the other key word in all this is flexibility. I think what I'm seeing programs do, which may be a more reasonable approach to this, would be, okay, you might extend the time frame in certain situations if that's applicable. But to Cynthia's point, you also better make sure administratively you have a way to document these exceptions so that if people do have to catch up at some point, or that you can show that they met some other requirement. So I think it takes a deep dive into your program. But it also bears to mind, I mean, so you're just thinking about it from a practical standpoint. If we lower the eligibility criteria, it's easy to say, well, this is because of COVID, but it also calls into question how valid was the original eligibility criteria. And that's kind of where the rub is. So I think it's taken a deep dive into really thinking about why your program has the eligibility that it has. And there may be other ways to work through that, but it's a deep issue and one that takes some time and not one to just make a quick decision on.
Yeah, and I'll say this, and I want to be careful how I phrase it so it doesn't appear insensitive in any way, is the idea of We had a group we were talking to about policy exceptions in a variety of ways. And, you know, how long is, and as this crisis has unfolded and continues to unfold, you know, what is COVID responsible for and what is it not responsible for? You know, where is the flexibility? Is there a point where it's too far? And what is that point? And for each group, you know, going through that thought process of, you know, if we're extending timeframes, how long do we extend those timeframes? What are the conditions in which those timeframes would not be extended or they would go back to normal timeframes? So, you know, there's certainly a lot to consider. And as Bill mentioned, if you're an accredited program, there's that element as well. And then there's certainly just best practice and the value and perception of your program in the market. So it is 11:40 here on the East Coast. I know some others, you guys have, a good portion of you have held in for a long time now. Thank you. We have lost some people who I'm sure had some conflicts on their calendar. I want to hit up one final question, the kind of ending on a positive note. There's some different comments that we didn't get to everything in the chat, but certainly our program committees will take a look at those from CNG's perspective and see where we can create opportunity in the platform to discuss those, particularly that idea of, you know, the low candidate numbers and what is the scenario for that? How are groups handling that question? Certainly seems like it's a session in and of its own. Perhaps 2 hours is not going to be enough for that one. But let me ask our panelists to end on a final note before we get to some announcements. What is, if I can dare to say, what is the silver lining? What have you found a silver lining here? What is there something that's happened in your reaction to this crisis and the future that we hold that has given you a different opportunity that you may not have had previously? So kind of let's start talking about that reactive and all the things negatively we've had to deal with and manage for. But is there something positive that's come out of this for you? And Bill Ellis, I'll ask you to start.
No, great question to end on. So, you know, I think the lens you use to look at any situation, any crisis is important. So for us, it's an opportunity to figure out what we can do differently, figure out what's working, what doesn't work. So it's an opportunity for us to kind of learn about ourselves. I would say from a very practical certification learning, two, really. One, we can do a lot of stuff virtually that we don't have to be tied to these face-to-face meetings and those ways of doing things, even though they are extremely valuable and have their own unique value propositions that we don't want to lose. The other is we used to, and we still do, test in 2 windows. And it's really got us thinking about changing our exam administration process to continuous testing so that we are not as boxed in by time or events. It'll take us a little while to get there, but that's one of the changes I can say right off the top of my head that's probably coming in our certification program. So, yeah, again, I think we all have to look at this as an opportunity to learn. The other thing would be too, hey, you know, we all try to drive change. And sometimes a crisis will facilitate people moving more quickly. If I tried to sell to our 13 programs, we're going to do everything virtual next year as a pilot under quote unquote normal circumstances. There's no way I would have ever gotten that done. I would have probably gotten 95% of the groups to push back and say, we're not doing it. So, you know, there's some opportunities here, and I think you have to frame all these things as opportunities.
Yeah, agreed. Tammy, how about Intelios and your position there?
I think for us, the biggest silver lining has been the change in mindset. Mindset from, again, given that we were such a physical organization before in terms of being, you know, face-to-face and having so many events on site, and thinking there's no way we could ever be 100% remote. There's no way that we can do all of our exam development in a remote setting. There's no way. And what this has shown is there absolutely is a way. And, right, you know, we will not be going back. So now what does going forward mean? We're still working on what that means. But I know that what was pre-COVID will not be post-COVID in the next space.
Sure. And do you feel that on some level that because of this, there is an opportunity to kind of reshape what post-COVID looks like and the opportunity to have this kind of experiment with some different models?
Absolutely. I think it allows us to reshape and to rethink about, how we're doing things from a systematic, very similar to what Bill says. So looking from a tactical, looking at our programs, looking at our processes, looking at the systems that we have. It will allow us to look at them differently, to ask different questions, and to scenario plan in ways that honestly we probably wouldn't have thought to scenario plan before going into this space. And that will open us up for opportunities to be even better than what we had initially anticipated.
Sure, thank you. And PTCB, how about from your organizational perspective, what can you find as a silver lining here?
Yeah, I mean, the thing I'm most, oh, sorry, go ahead, Bill.
No, go ahead, Levi.
I mean, this is just me personally, and then I'll let Bill chime in. But, I'm in a way super happy to see that we've made this change to remote proctoring. It's something that we've thought a lot about for a long time and just never really had the impetus to get over that, that inertia. And, we'd wanted to do it for some of our newer, smaller, lower stakes programs, right? But here comes the fire hose of data for us to evaluate. NCCA has been doing a pilot, but years ago there was a task force to look at this when remote proctoring was still this nascent kind of a technology. And I think my takeaway from that back then was unless there's a need, we're not going to see this. And boom, I didn't see it coming in this form, but here is the need, because we'd gotten to a point with our the footprint of our physical exam administration that we didn't need remote to serve an accessibility kind of a need that way. So that's a big happy thing for me. And then I guess the other, before I let Bill chime in, is it's kind of leveled the experience level across the organization for those who had previously had remote work experience and those who hadn't. Sort of the haves and have-nots in that regard. So I think that's really helpful because it opens up a lot of possibilities to what the future will look like. Seeing a lot of what's going on in the chat about, I don't think the post-COVID way of doing things is going to be the same as pre. And I think that's absolutely true. And we've got a lot more tools at our disposal to explore what the best thing is for us when it comes to how we meet and where we meet, right? Even our physical space and what those needs might look like in the future.
Yeah, and then just really quickly, because I think we've hit really the major things here. But one of them is, because I think Levi and I were of one mind, is that we just have this gigantic data set now across a number of categories, not just remote proctoring, but what does it feel like to all just work virtually or somewhere in between? And then I've even been thinking about, we've mostly stopped traveling, and life has gone on. I think travel will obviously come back, but I think a lot of organizations are going to take a look at this as, do we need this expense in some of these cases, not just for subject matter expert meetings, because as Levi noted earlier, I think those volunteers really, really enjoy that face-to-face interaction from a professional perspective. But even some of the trade shows and association meetings and things like that, we've lived without them for a very long time right now. And I know I will miss them as well if we don't go to as many, but that is a distinct possibility.
Well, thank you all so much for sharing your insights. I will say, for one, I'm craving a little travel. I could use less, but I could use a little, just a little. Thank you all to our panelists, to our participants, to my fellow committee and board members who helped to organize this session. I am going to try, in the spirit of being adaptable, typically at the end of a CNG meeting, we allow for announcements. So there's still about 70, 75 participants. If you have an announcement that you'd like to share with the community, if you could raise your hand, I will do my very best to navigate the WebEx platform. I admit I'm a Zoom user, so This might be a little bit tricky for me, but if you have an announcement, I'll scroll down and see if we see any raised hands. While that is going on, if anyone has an announcement to make, I will do another plug for getting involved with CNG. You know, one of the best things that I find out of this platform, and I'm coming to the end of my board service this year, is the ability to have conversations with our community and, you know, having pretty open, honest conversations and not really having to filter those necessarily. So I appreciate the opportunity to have these events. Of course, it takes a large team of volunteers behind the scenes to make the events happen, as we all know. So if you're interested in serving on the board or the program steering committee, right now we're still organized by city, but we're working together as a Chicago and DC planning committee to bring national events. So that we'll see how long that lasts. So we're city by city. Please submit your applications. Check out the website for more information. So I do see Abby. I'm going to put you, unmute you. You've done that yourself. Abby, do you have an announcement for us?
Sure. Yeah, I just want to remind everyone that we do have our upcoming Surpass conference. Unfortunately, it is virtual this year, much like everything else, but it's coming up October 7th through 9th. We have some exciting keynotes this year, speakers from Microsoft and the World Bank, and actually an award-winning learning futurist named David Price, OBE, actually. So you can reach out to me, abby.eston@surpass.com, or more info, you know, you can always find it online at conference.surpass.com. So if anyone's interested in attending our conference, thanks.
Great, thank you. Certainly share other comments or other events, virtual events that are happening. I'll say my silver lining of COVID and the time of not traveling is that I've been able to attend more conferences than I might not have been able to do in a normal travel year. So that's been really helpful. Are there any other announcements? I don't see any other hands raised. I do encourage everyone to continue this conversation in the CNG LinkedIn group among your colleagues. It's really helpful, especially in this time of uncertainty and what the future holds, to have these conversations and learn from our colleagues and our network. And that's certainly behind the value proposition of this organization. So I encourage you to, as much as you can, continue these conversations in the LinkedIn group. We will keep you informed of future dates for webinars, and we will certainly let you know when we are able to get back to a face-to-face environment. So with that, in a few minutes back on your calendar today, thank you again to Tammy from Intelios, Bill and Levi from PTCB, and Bill from BPS for your willingness to participate and share your stories and your insights. Great. Sure. Thank you all so much. Have a good day.
Thank you. Take care.
Bye.
Thanks.
Bye, everyone. Thank you.
Thank you.